So in our experience, at Medco we had several clinical programs for pharmacogenetics, and what was really interesting was the way these programs were set up was when somebody comes to the pharmacy with a prescription for a drug for which there would be a genetic test available that helps guide therapy, we were able to contact the patient and or physician basically in real time, because that's when we got the information about the patient being at the pharmacy, inform them about the availability of the genetic test, and see whether they're willing to do that, whether they think that might be a good idea. What was interesting is that when we were contacting patients, the acceptance of doing a genetic test was about 85 some percent saying yes. When we contacted the physician first, it was way lower. And that might have different reasons. However, the bigger message is that I absolutely do not believe that there is a fear, a significantly big fear in the population about what we're talking about. I think this is much more portrayed by the professionals and by ethicists. So I have absolute confidence in the population, in patients being willing to not only participate in research, because a lot of what we were doing was research-based, but also in the actual use for this information in clinical decision-making. What is absolutely key is the upfront education, what you're going to be doing with this information and how it can be used, and whether or not it can be used in the future as well. But by and large, I have absolutely no issues believing that generally we're going to be able to access that information.
So you're saying
we're putting artificial boundaries in place that we absolutely don't need.
Can I just comment on that? I think that you hit on a very important point, which is the trust. Mm-hmm. We are actually also in the process of setting up this similar consent form, starting to bank people's specimens, discarded blood samples, et cetera, banking their data. And I think